Is there one Medicare plan that's right for everyone, or at least for the majority of Medicare beneficiaries? Despite what some would lead or mislead you to believe, the answer is no. But is there one Medicare plan that is more efficient, more effective, more predictable, and easier to use than all other Medicare plan options? Well, that answer is yes. And in this video, I'm going to tell you what that Medicare plan is, how it works, who should seriously consider it, and who shouldn't. Hi, I'm Chris Bryan, Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in numerous other states as well, which you will see later in this video. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. Rochelle E. Goodrich said, "You were born, and with you, endless possibilities. Very few ever to be realized. It's okay. Life was never about what you could do, but about what you would do." So unless you have Medicaid, 100% financial assistance from your local hospital, retiree health coverage from an employer, a union, the government, or the military like Champ VA or TRICARE for Life, then you need to know and should be aware of all of your Medicare options, not just one or some of your options. So what is the most efficient, most effective, most predictable, and easiest to use Medicare plan? Well, if you guessed the Medicare Supplement Plan G, then you guessed correctly. And in case you don't know what a Medicare supplement is, a Medicare supplement is also called a Medigap policy, and they have been around since 1966. They are standardized plans, meaning a Plan G is exactly the same with the same benefits regardless of the company you get it from and the state in which you live, unless you happen to live in Massachusetts, Minnesota, or Wisconsin, which standardize their supplements in a different way. So why the Plan G? Simple. There are only two things that you need to deal with. One is paying the premium, which typically goes up every year, and two, the annual Part B deductible of $240 for 2024, which also usually goes up every year. So between what original Medicare pays and what your Plan G pays, you have 100% coverage for everything under Part A and Part B after you pay the Part B deductible. So no Part A deductible of $1,632, no Part A co-payments of $408 to $816, Part A coverage beyond your 60 lifetime reserve days, no Part A skilled nursing co-payments of $200 per day from day 21 to 100, no Part A hospice care co-insurance or co-payments, no 20% Part B co-insurance, no bills for doctor visits, the ER, urgent care, lab work, radiology, outpatient surgery, chemo and radiation, dialysis, durable medical equipment, etc., etc., etc. Also, no Part B excess charges and 80% coverage for foreign travel, emergency, and urgent care within the first 60 days while out of the country of up to $50,000 in coverage. So Medicare supplement plans can be very easy to use. They offer predictable costs, meaning they are easier for your budgeting. There are no surprise out-of-network bills. If the provider accepts Medicare patients and Medicare covers the service provided, you won't need to worry about who is in network or if the provider has switched networks. There are no provider networks. You are not restricted to certain doctors and hospitals unless you get a Medicare Select supplement, which I advise you don't. And you can see my video, Caution, do not pick this Medicare supplement plan. You can see any provider that accepts Medicare, which is about 97%. You will have access to specialty hospitals, no referrals. You can see any specialist who accepts Medicare patients, and they won't have to see a primary care first to get a referral. There are no pre-authorizations. Medicare supplement plans don't require advance approval for care or treatment, but original Medicare sometimes does. So no benefit or claim denials if original Medicare covers it and pays first. So who should seriously consider a Plan G? Someone turning 65 and is guaranteed to get it till 65 and a half and has serious health issues and or tends to frequent the doctor and hospital a lot. Perhaps cancer, kidney failure, other chronic conditions, you need physical therapy, and you can see my video, pick this Medicare supplement if unhealthy or you have a chronic condition. And someone that just likes to set it and forget it. By the way, if you're finding this video helpful and don't want to miss other great content, please consider subscribing. It is greatly appreciated. What about other good Medicare options? You could consider the Plan N, great for healthy to relatively healthy people. meaning 8 or less times per year for Part B services. You would have small co-payments of up to $20 for some office visits and up to $50 for the ER. You also have Part B excess charges, which is rare, and you just went to one of the 3% of providers that don't accept Medicare assignment. The premium typically goes up slower on a Plan N than a Plan G, and you can see my videos, the Plan G versus the Plan N, the Med Sup for healthy people, and which Medicare supplement plan is best. You could also maybe consider the high deductible G. That is ideal for extremely healthy people that maintain their health and hope to stay in good health. I call this a catastrophic supplement. It has a $2,800 deductible as of 2024, and that deductible goes up every year based upon the Consumer Price Index. So if the Consumer Price Index goes up fast, then the deductible goes up fast as well. But it has very low premiums, so potential for significant premium savings over time. And you won't be burdened if you have to come up with the deductible. And what about a Medicare Advantage plan? Well, 2 words, be careful. You want to make sure if you're considering a Medicare Advantage plan that you get good prescription coverage. All your doctors should be in the network, or you have a PPO that has what's called a passive network, meaning you can go out of network for the same cost as in network. You want a plan that has a large, stable, nationwide network. You want a plan with a very low maximum out of pocket. You understand how they work, which most people don't. And you need to understand that it is private Medicare insurance. Providers can come and go whenever they want. You will have more prior authorizations and benefit denials. You will have more co-payments. You will have more managed care, which some people do like, but significant premium savings and extra benefits. But you never ever choose a plan based upon the extra benefits. And you can see my videos about the 3 main risks and 3 main rewards with Medicare Advantage plans. So is the Plan G the right plan choice for the majority of Medicare beneficiaries? No, but it is the most efficient, most effective, most predictable, and easiest to use Medicare plan option. And roughly 70% of people choosing a Medicare supplement do choose a Plan G. You might be asking yourself, Chris, what would you choose if you were turning 65? Well, if I were turning 65 today, and based upon my current present health, my mindset, my lifestyle choices, my fitness choices, the food I eat, my family history, and my overall philosophy, I would choose between a high deductible G and a Plan N. Up to earlier this year, I would have told you the high deductible G without a doubt, but since inflation has been running high and the deductible has started going up faster than it ever has, I may go with an N instead, but I have 6 more years to worry about that. And would I ever consider a Medicare Advantage plan? Well, surprisingly, that answer is yes, I would, but it would have to have a low maximum out of pocket and be a PPO for me to choose one. I could care less about the extra benefits. You do not choose a Medicare Advantage plan based upon extra benefits. Unfortunately, all the telemarketers and all the 800 number ads you see on TV, that is all that they push. So run away from them as quickly as you can. So when you need help making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, then please feel free to reach out to me either by phone or through one of my contact forms on my website. And if you happen to live near the Charlottesville, Virginia area within about an hour to an hour and a half and you would like to meet in person, then please reach out to me and we could probably work that out. That's it for today. If you want to stay up to date and gain more insight on maximizing your Medicare insurance, then please consider subscribing. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.